Thank the gentleman. I rise to engage in a colloquy with Ranking Member Visclosky and Chairman Frelinghuysen. But first, I would like to commend the Chairman and the Ranking Member for their leadership on this bill. I am here today to address the importance of delivering the utmost care to our brave servicemen and women who suffer from mental health disorders, and the benefits that public-private partnerships between the Department of Defense and teaching hospitals can provide, specifically to members of the National Guard and Reserve components who return from tours of duty and transition into civilian life far from a military base and without easy access to the care that they need. I am pleased that the Department recognizes the benefits of these public-private partnerships and created a pilot program to improve efforts to treat members of the National Guard and Reserve components and their families who suffer from mental health disorders. But we must not stop there. It is heartbreaking that readouts of suicide data for 2013 show that the active component rate has come down about 18%, but the reserve rates rose slightly. This problem is not going away, and that's why I'm so pleased that the defense bill included language in the bill's report recommended by the gentleman from New York, Mr. King, and me, that encourages the Secretary of Defense to expand this initial pilot to include additional community partners through a competitive and merit-based process. There are a number of teaching and clinical hospitals around the country that specialize in mental health treatment and can make a real difference in addressing the soaring demand for mental health treatment. I would like to work with the Chairman and the Ranking Member to ensure that the Department has the necessary funding to expand this vital pilot program so more of our nation's brave service members are able to receive the best care possible. And at this time, I would be honored to yield to Chairman Frelinghuysen.
Mr. Chairman,